Massage alchemist, the power to change and transform.
Today, let's talk about chronic and lasting lower back pain. So, a very common question we get is, does massage therapy work for chronic low back pain? And I'm talking about the low back pain that has lasted for years and years, like the 20-year-old low back pain, 15 years, just years, right? That's what we're talking about. When somebody comes in with this, we're going to be asking them, what makes it better? What makes it worse? Is there anything you do daily to help relieve the pain? Does stretching help? Is it in the morning? Is it in the evening after work? Is it all the time? Those are the types of questions that we ask. So the first question is, bottom line up front, does massage therapy help with chronic low back pain, or can it help? And the answer is absolutely yes. Now, usually somebody that's coming in like this, we're cautiously optimistic right out the gate because we do have great success with it. And the reason we're able to have success with it is we work very deeply and very thoroughly in the quads, the glutes. We check the psoas. A lot of people with chronic or lasting low back pain, they need a complete psoas release, which takes time and it doesn't feel very good, but you do typically feel a lot better when you're finished. So people that have had that lasting back pain, once you get everything released that can contribute to low back pain, a lot of the time they get a significant improvement in their symptoms and a reduction in that pain. Now, I'll start by saying a lot of people do get complete relief. Like they are able to go from pain every day to, not needing to come in that much. And by not that much, I mean, they may come in 3-4 times a year for a tune-up if they like tweak it again, or they bend over, they work hard in the yard or something, and it just kind of brings it back a little bit. But most of the time we can get people to a maintenance level. Now, where this changes, or where it gets a little more complicated, is when people have had like a fall, a significant sports injury, some type of significant trauma, or maybe they've already had a surgery. Okay, so I'm talking about people that have had repairs or extensive physical therapy after a low back injury of some type or a trauma of some type. So those results get a little bit more mixed. And usually it's a trauma that set it off. If they've never had any type of treatment, soft tissue work, therapeutic massage, medical massage tends to really help a lot. And a lot of those people do get better. Now, the people that have had those significant traumas and have already had treatment, depending on what it is, they may not make a full recovery. So what we'll see is they'll get a big improvement, and then they just kind of level off. And then where they level off, it may be we can get them to 2 weeks with no pain, or maybe we get them to a month with no pain, and then we just can't get past that. That's usually because there's some other type of structural thing going on. I'm talking like it could be a bone spur, or there was, maybe the surgery didn't heal like it should have healed. Maybe there's some type of exacerbating scenario. Like a lot of times you can have a surgery to repair something, and then you go back to playing your sport. Say it was a sports injury, or you go back to work where you're still doing the thing that hurt it in the first place. And if you have to do that, then that's going to limit how much progress you can make. And that's really true of any injury, not just low back pain. So something to keep in mind. Got a couple notes here to keep me on track, but really, like, another super common question is if you have like a bulging or herniated disc. Again, if it's a slight bulge or herniation, many times we have lots of people that have a slight disc bulge in the spine or a herniated disc, and they walk around every day pain-free, 95% of the time. And then again, if they just, they do something in the yard or whatever, pick up the grandkid, or, they're playing ball with their son and they just twist wrong, so that can aggravate it. But a lot of times we can get them back in action 1 or 2 sessions, and then they can go to as needed again as far as, getting the really deep therapeutic work done. It depends on where the bulge is. It depends on how much herniation or how much of a disc bulge there is. So these are things to keep in mind when we're talking about what kind of outcomes you can have. The severity of that bulge in the spine is going to dictate how far we can go with the body work. A lot of times, again, we can have a significant bulge or herniation and still get complete relief, or 80 to 90%, which is great. Some people that have been recommended, that you need surgery on this, they've been able to avoid surgery. They say, okay, I don't, it's not that they're against surgery necessarily, but they could be like, I don't want to have it until after I retire, or they don't want to have it until next year because they've got these things going on in their life that would dictate them being able to be functional now and not taking that long recovery process. So when we're talking about surgery, right, always listen to your doctor's recommendations. We're not sitting here saying, oh, we can keep you out of surgery forever or anything like that. We can't, okay? That's just not how it works. Our work has limits, just like any other type of professional's work has limits. And we always try to stay extremely respectful of that, especially when we're dealing with people's medical issues, obviously. So I just want to put that in there. I'm sure you probably already surmised that, but it's important to note. Let's see here. As far as expectations in the body work and kind of walking people down that path, right? So we don't know how far we can go with the body work until you come in and we get 3 sessions under our belts and say, okay, we have a good idea of where we're at and where we're going. And usually by the 3rd session, I have a pretty good idea of how far we're going to be able to take it in general. Not always. If it's extremely long-term pain and you're still very active and engaged in the activity that perhaps you got injured in the first place, that's a longer road always. It is, because you're not able to take rest and time away from the thing that actually injured you in the first place. If you can do that, that's even better, because you're going to heal faster and you can see how far the body work will take you. Most of the time, we're going to know by sometimes at the end of the 1st session, usually the 2nd, 90% of the time by the 3rd session, are we going to be able to get you completely pain-free? So that's what we're looking for as we go down this road. So anyway, if you got any questions about low back pain, send us a message. Let us know. We'll be happy to answer them. And as always, you can come in and see us. Check us out, massagealchemist.com, and we'll see you in the next video.